you, Deputy Taoiseach.
First of all, I think data is extremely important in terms of the entire experience of COVID and in terms of learning from the first lockdown, which we did actually, and then to inform the experiences of different phases of COVID-19. So, for example, coming out of the first phase and the country reopened, and then cases began to rise again towards the end of August, September period, or during August, September period. We've brought in a team from the HSE, commissioning EY, to look at all of that detail in greater, with greater analytical tools, and to sort of identify where outbreaks happened, what was the correlation, what were the events, what were the combined circumstances that gave rise to spikes across the country. And so the HPSC, the HSE, the Department of Health, the Central Statistics Office, other government departments, so you've referenced Health, Department, Enterprise Department, Finance, Department of Public Expenditure, Department of Social Protection, Justice, have all been involved in inputting into the assessments and the impacts that COVID has had on the different sectors of society. And that will inform how we exit level 5. And we're learning all of the time. And I just want to make that point. And the data, we will publish that data as well and make it available to give people some understanding as to why we are arriving at particular decisions in relation to how we exit level 5. And I've already identified some areas that have been of concern that has emanated from that particular data. So, for example, in this phase, we kept the schools open and we kept construction open. In the future, you could take it that we would do things differently from how we did them even during level 5 and from the first phase. So we are learning all of the time. On mental health, I think it's important to point out, you had made a point, there was at certain points, there's 2 sources of self-harm figures, the hospitals and clinical programs. Hospitals couldn't report for a period of time due to COVID, but reporting on statistics continued through the clinical programs throughout COVID. The data from the clinical program shows at the moment, and I qualify this heavily because I do think we need more data and we need more comprehensive research on this, that there's no evidence of an increase in self-harm as the figures are broadly similar to the same period last year. I put a caveat on that until I'm satisfied that there's a full comprehensive analysis of all the data. In relation to suicides, there's a time lag as it has to be determined by the coroner. However, a real-time local study of suicide incidents in Cork shows no significant increase on 2019 figures. And interestingly, a study on suicide in England found no evidence of a large national rise in post-lockdown suicide compared to pre-lockdown suicide. It's an area that will continue to receive our attention.
Yeah. Thank you very much, Taoiseach. I greatly welcome your commitment to publishing data, and I note that Ernst & Young have been brought in to crunch data. Like, if that's data that's provided by the state or an organ of the state which is collected with public monies, then that too should be made available. But the most important thing is that the evidence and the data available to NEFIT and the modelling code, and there is information about the code published, but not enough, I'm told by statisticians, I'm not one, but not enough to run a counter, like to do a comparison. But to return to the mental health data, I know what you say, there's data there. Will you publish the data that was available to the government in the middle of October? I know you say it's not complete, but what was available and what wasn't? Because I think we need to know this in a democracy. Will you commit to publishing that? I'm not asking you to go and get lots of information, just what information was available to the government at the time. Will you publish that by the end of this week, or at least by this day next week?
Thank you, Deputy.
And secondly, is there any study on the impact of the mental health tribunals? Because they too have been, obviously, we have changed how they operate. Has there been any study into the impact of the change in how they operate on those who are affected, i.e. those who are involuntarily detained?
Thank you very much, Taoiseach.
Yeah, recently at a Cabinet subcommittee meeting, Minister Mary Butler, Minister for Mental Health, presented a comprehensive report in terms of mental health services generally, but also then in relation to the impact of COVID. Now, generally speaking, services have been maintained at 90-95% throughout the COVID period, which is a great credit to all of the professionals and all of the staff involved, and very significant additional funding has been secured by Minister Butler in terms of the mental health budget. And at that meeting, and I think we subsequently would have briefed you, I think, at a leaders' meeting, leaders' briefing meeting, in respect of the information we had, which I've given it to you now. I mean, the information had come from both the suicide prevention office, which is located in Cork. But any data we have, we'll publish and we'll send it to you. I have no difficulty with that. All data should be published because it's there to inform public policy and public commentary. So I have no issue with that. But I just wanted to, you asked, when that was the impact. That was the presentation made by Minister Butler at that cabinet subcommittee.
Thank you, Taoiseach. That concludes leaders' questions. We move immediately on to questions on promised legislation, where 31 deputies have already indicated, including 13